So go to yeah. I mean,
Interesting. Okay.
it's just that it's not a
How is it coming in? I'm not. So which one is it? The one
Check.
at the top
yeah, the top
when I
one.
download?
Mm-hmm. Yeah, just keep going.
Okay. I gotta remember how to put your. That's interesting because I'm not.
Yeah, it's just that it's not a standard size that you're you know.
All right. What do I need to know over there?
So your mic is green and it's muted right now.
I think I was supposed to.
Oh, so you fixed it. So I can
You
click
should be
away.
able to click yes. We're having to bring it in different, so it's, you know.
That's fine.
But
So show me like.
so basically, it's the big button to go forward. If you go back, it's just that button. And so we're not,
Oh, you don't have it set up.
yeah.
Okay.
So as soon as, let me show you. So,
Thank you all.
so see if it's hit it now. Click it now. Yeah.
Oh,
And you,
that's
and you, and you can go back. Yeah. So we're trying to get it there.
you all are amazing.
We're trying to make it there. We're trying to make it happen.
I'm trying to make it easy for me.
All right. So
That
you brought one in.
that moves this.
Yes.
So
So she
how
can.
would I be able to still be working on it while she's talking? Would I be able to?
That may not be.
Good morning. Hello, is everybody okay?
I don't know where it's going.
I'm gonna sit on the side and be watching y'all take pictures of y'all.
Oh,
First
man.
person star over
I'm
there.
ready for this one.
you very much.
Do you loan me $500?
Yes, I'm here. Thank you so much. Just letting you know y'all live. Yep. Excuse me, you're gonna have to speak into the mic.
Okay. Thank you all for coming out this evening, and thank you, Pat, for bringing the presentation for the Medicare update. Pat not only does Medicare, she does regular insurance, healthcare insurance, life insurance, disability insurance. She has a wealth of information. So I'm going to turn this over to Pat Mayfield at this time and let her educate us all. Thank you.
I'm going to take the mic out and kind of walk around, okay? Well, my name is Pat Mayfield, as she mentioned. My agency is PCM Insurance Agency. We've been in business for over 30 years, so that kind of tells my age. I got shocked a couple of years ago when I hit 65. And I go, oh my God, all these people are calling me and sending me letters and telling me that I have to get ready for Medicare. And I'm a Medicare agent, right? And I was like, I cannot believe I'm getting all of this mail. I get it now. Never got it before until I got all of the mail. So I understand, what you're going through and all of the stuff that you get from them. I also do life insurance and regular Obamacare insurance for individuals that are under 64 that may be in that in-between stage. They may have retired at 62, decided to get their Social Security, but now they don't have insurance because they're not with their employer anymore. I assist a lot of people in that area between 62 and 65. So just to kind of let you know. Well, let me do a couple of disclaimers at the beginning. She hadn't even gotten into the presentation. Now she's doing disclaimers. But let me tell you a couple of things here. This presentation is Medicare 101. And I get it that some of you may already know how Medicare works. One of the things that I like to do is to talk about it again, just to make sure that you've got it. The other thing that I'm going to do today is give you an update on what's happening in 2025, okay? Because there have been a lot of changes to Medicare for 2025, and I don't know how many of you have already received what's called your annual notice of change. Have you all received those? Okay. Those annual notice of change are just kind of letting you know what's going to happen with your plan in 2025. Now, the problem with it is the biggest change happened to the prescription drug part. So if you're in a Medicare Advantage plan, for example, a Part C plan, it is a prescription drug part that has changed the most, okay? And because of the prescription drug part, now the rest of it, they're adding additional co-pays and that kind of thing that you have to have for other parts of your plan. So we'll talk about that today. The other thing I want to share with you is that I can't talk specifics today. The only thing that I can talk about today is Medicare and the changes that are going to happen. But for example, let's say you had a question about your particular plan and what happened. Can't talk about that today because we can't talk about that until after October 1st, because Medicare requires that agents not talk about any of these plans or what's going to happen with them until October 1st. Now, after October 1st, if you have a question, you ask me. I'll be happy to share any information there. After October 15th, we can actually, if you decide you want to switch plans to another plan, if you want to keep the plan you have, whatever, after October 15th, you can enroll in plans. So they have dates for certain things that you can do and when you can do them. So just want to make sure you understand that up front. But if you have any questions or anything, you know, once again, any general kind of questions about Medicare. How many people do I have in here that are over 50? I just thought that was funny because I know this is the 50. I know this is the 50 and over, right? Okay. How many are over 55? Okay. How many are over 65? Wow, okay. Over 65. 65 and over, right. How many are under 50 that showed up just because? Okay, all right, just saying. All right, so this is the thing. A lot of times, if you're under 65, what happens, a lot of times you think, well, you know, I don't even know why I need to be in one of these Medicare 101 things because I'm not 65 yet. I like people to come in before so that you actually understand. But in addition to that, it's not just about you understanding for you, but you understanding for your aunt or for your mom or for your grandmother, because they may or may not understand how it works. And if you understand, then you can help to explain. So I tell people, even if you're 50, under 65 and not quite at Medicare, it's good to know about it in advance, okay? So that when you get all those letters and everything, you don't get all like, oh my God, why are these people sending me all of this stuff, okay? So that's I just want to make sure that I share that with you. Okay, I think. So while I'm waiting, let's talk about this. What we're going to be talking about today, of course, is the alphabets of Medicare. A, B, C, D, and I wish I could call Medicare supplements E, but that's not. That's not correct. Can't do that. But A, B, C, and D, so that you understand how all of them work. Now, I know you really pretty much understand, and so we can quickly go through that part if you already have that. But if you have any additional questions about things as we go, then we'll go there. Okay.
You can try now.
Okay. Aha, wonderful. So today we're going to cover who's eligible for Medicare, the Medicare enrollment periods, okay, understanding your Medicare options, and then I'm going to have some helpful resources at the end. Okay, are you eligible? Now, based on the eligibility requirements for Medicare in the United States, you have to be at least 65 years of age. You got that, okay? You have to, or be 65 and under with a disability. So let's say you're on Social Security disability and you're under 65. Those individuals also qualify for Medicare. But once you become eligible for that disability, you have to wait 24 months before you're actually eligible. So a lot of times I'll have someone come to me and say, hey, Pat, you know, I just became eligible for Social Security disability. I don't understand why they're not letting me get my Medicare. Well, it's because you have to wait 24 months. And after that 24 months, then you'll become eligible for Medicare. Also, you have to be a U.S. citizen or a legal resident and have been here for at least 5 years. That's it. Now, I'll share one other thing, too, For those of you that are 65 and older, when you're working, during your lifetime of working, we have to at least have 40 quarters of work in order to qualify for Medicare. So 10 years of full-time work is what it is, okay? And then you can become eligible. Okay, this is something that I really like to talk about because people don't understand that there are many times in which during the year that you can enroll in a Medicare plan, okay? Most people understand the initial enrollment period, and that is the 3 months before you become 65, the month that you become 65, and you have up to 3 months after to enroll in Medicare. So that's the one that a lot of people already know about, and that's great. The annual enrollment period is the period between October 15th and December 7th. That's the one that a lot of times people think that's the only time that they can enroll, okay, between October 15th and December 7th. So most people know that because you'll have 1,000 advertisements on TV to say it's time to enroll, it's time to enroll, it's time to enroll. So that is that period. Everybody can enroll during that time. A lot of people don't know about the open enrollment period for Medicare. And that period is between January and March 31st. So let's say you enrolled in a plan during the annual enrollment period, right? Whatever the plan is. And then you decide in January, oh man, this plan does not even accept my doctor. I thought sure that doctor was going to be in the network, and he wasn't, right? In January, you can enroll in a plan that has your doctor in the network. That gives you another opportunity to correct that mistake. Or let's say you talk to an agent, and that agent told you, hey, yes, your prescription is in this formulary, right? And it wasn't. You have another opportunity between January 1st and March 31st to enroll in another plan. Now understand, that's only if you're in a Medicare Advantage plan, right? So if you enroll in one of those plans, Part C plans, we'll talk about that in a minute. But if you enroll in one of those plans, you can change that in January through March. Other thing I want to mention about that is but that is the only thing that you can change. If you decide you're no longer in that Medicare Advantage plan and you disenroll from it, either you enroll in another or you just go straight to original Medicare and a prescription drug plan. Okay, so you can get out of it. It's just that you won't be able to enroll in like a Medicare supplement or something like that time. Okay? All right, special enrollment period. Now, this is another time in which you can enroll in a Medicare plan at other times of the year. And that is generally if you're moving from one resident to another. Like you're moving from Richmond to Henrico, for example, or you're moving outside of the area that you were living in before, the zip code that you were in. You can enroll. That opens up a special enrollment period for you to enroll in another plan, okay? Also, if you become eligible for extra help or Medicaid or something like that during the year, that also opens up another opportunity for you to enroll in another Medicare plan. Let's say you've been diagnosed with a chronic condition, you know, diabetes or chronic heart disease or something like that. That also opens another opportunity. So see, it's not just the annual enrollment period that you can enroll. You have other times during the year that you could if there are specific circumstances that happen that put you in that position, okay? All right, so you have 2 months after that qualifying event. So let's say you go to the doctor in January, God forbid, and find out that you've developed diabetes and you want to enroll in a diabetic plan, for a chronic condition plan. You have an opportunity to do that up to 60 days after you found out about that chronic condition, okay? All right, so let's talk about our Medicare options. Remember the red, white, and blue card that you got when you first became eligible for Medicare? Well, one of the things that, to help you understand, and I know, once again, you guys really understand, Part A, Medicare Part A, is the part of Medicare that pays for hospitalization, skilled nursing facilities, home health care, so some home health services, and hospice, God forbid. So those are the 4 areas that are covered by Medicare Part A. Part B covers everything outpatient. So you go to your doctor, you have to have some diagnostic tests, you have lab work that you have to get done. All of those things are paid by Part B on an outpatient durable medical equipment. Anything that's done on an outpatient basis is paid with Medicare Part B. So Part A covers everything inpatient. Okay, I tell people everything where any services that you have to go in to have it done and stay. Part B covers everything on an outpatient basis. So if we're talking about surgery or whatever, all of that is covered by Medicare Part B. One of the things that I do want to mention about Part B, while you were working, everybody paid their premium for Part A. Y'all remember when they were taking it out of our checks every single week or a month or every couple of weeks, however you got paid? They were taking the Medicare premium out of your check. Well, that paid for Medicare Part A. And so with that, you have no premium for Part A. But remember the shocker that you got when you decided that now I'm going to do Medicare, and now you have to pay a $174.60 Part B premium. That's because you didn't pay Part B while you were working. That's why you're paying it now. Okay, so that's what happened. That $174, they said, hey, you know, we love you and you did a great job while you were working on that Part A thing, but Part B, you got to pay your premium. So that's where it is with Part B. Okay, so now with Medicare A and B, that is actually administered by the federal government. Okay, so A and B administered by the federal government. Medicare Advantage plans, which is Medicare Part C, Medicare supplements, and prescription drug plans are all administered by private insurance companies. So that's how that works. A and B is the government. Everybody else is by private insurance companies, okay? So Medicare Part C, it has A and B in it, but in addition, the plan may have Part D, which is the prescription drug part. In addition to that, it may have dental, vision, and hearing. So all of that may be a part of a Medicare Advantage Part C plan. Or the other option is just to have a Part D, which is a prescription-only part, and a Medicare supplement. So I always tell people there are many plans out there. You know, in Virginia, there are over 200 of them, okay? There are bunches of them, okay? But there are only 2 options. You only have 2. One is original Medicare A and B, plus a prescription drug plan, Part D, plus a Medicare supplement, right, that pays what Medicare didn't pay, or a Medicare Advantage plan. Those are the only 2 options. So when you know that there are only 2 options, all you're doing now is trying to pick which company am I going with? Which one is going to be the one that's going to work for me? Okay? So a lot of times you'll get all of this stuff in the mail regarding all of these plans, and you're trying to figure out what am I going to do? You have 2 options. That's it. Medicare Advantage, original Medicare, plus a Medicare supplement and the prescription drug part. If you all have any questions as I go, please, you can stop me and say, hey, oh, there you go. I love it. I love that, please. That's correct. Okay, that's a good question. Okay, and I have people that ask me that a lot. So what happens is when you leave your employer may have a retirement health plan for you, right? One of the things that I have noticed is that retirement health plans tend to be give you a little bit more benefits, a little bit more benefits than if you were in a Medicare Advantage or in a Medicare supplement. And so a lot of times people will come to me and say, hey, can you tell me a little bit about how this is going to work for me? Well, I will look at everything that your plan does for you right now. And then we can compare those to what the Medicare supplement or the Medicare Advantage, whatever. Sometimes it's really to your benefit to stay in your employer plan. If they allow you to have a retirement health insurance plan after you leave, sometimes it's better. Other times it may not, because it may be that while you were working, your premium was only $100 a month. After you leave, they say, well, look, you gone now, and we love you. But that's going to be $600 a month, thank you very much, right? So it may be that it may be cost prohibitive to stay in that plan after. It just all depends on what works for you and your budget. Great question. Thank you for asking that. Yeah, sure, please.
Actually, this is what everybody's seeing. So you can click that up while she's.
Here's a microphone right here.
Oh, yeah, that's right. He did say.
You're not too young, too old to come over there,
What's happening? I had this plan,
Mm-hmm.
and the company that I work for has a union.
Okay.
So I found out the last contract, they switched to the Medicare. I think that's what they did, they switched to the Medicare Advantage plan.
Mm-hmm.
So my wife had a couple surgeries,
Okay.
and before they took the plan, now I think it switched to Medicare Advantage. They don't take it no more. Does that mean I got less coverage with the Medicare Advantage plan?
Not necessarily, but maybe. Okay, that's my answer, and I'm sticking to it. No. Well, what happens is, I think the reality is that you gotta look at all of what these plans are offering. They may be good, great, and wonderful, right? Maybe. May not be, but it's for every person. So what may be right for you may not be right for you or you or you. For some people, it fits. For other people, it may not. But was that a decision that was made by the company or by the union to switch to it?
Yeah, I think that was what happened. You know, the union and the company got together and figured out it's less cost effective with the Medicare Advantage.
Right.
Please speak into the mic.
And I didn't know.
Okay.
Because until she went to the people she had the surgery for,
Okay.
and gave them the new insurance, and they said, well, we can't help you. We don't accept that plan.
Okay, well, like I said, we can't talk about how this stuff is going to be in 2025. However, I mean, if you want to get with me so we can look at it specifically after October 1st, we can do that, because, you know, it may be that the plan that they switched to, it may have been a Medicare Advantage plan, it may not have. It may be some other kind of plan that they did. Let's kind of talk about that off mic or after October 1st. Yes. Okay, and we're going to talk about that. Good question. Her question was, what is the difference between a Medicare Advantage plan and a Medicare supplement? And we're going to talk about that in just a bit, okay? Just to have you understand that there are benefits that you get in plans other than, so Medicare A and B have some benefits or do not have some benefits that other Medicare plans may have. So for example, if you look there, most prescription drugs are not a part of Medicare A and B, original Medicare. Long-term care, a lot of people probably found that out because they needed assistance with long-term care and found out that Medicare doesn't cover long-term care, okay? Most care outside of the United States, vision, dental, and hearing, those are not covered under original Medicare. Gym benefits are not covered. under original Medicare. Some personal expenses in the hospital, like your TV and that kind of thing. And in addition to that, some psychiatric stays that go beyond the regular period that you can be there. So just know that there are some things that are not covered by original Medicare, which is the reason that there are other types of Medicare plans out there for you to consider. Okay, now let's talk about Medicare Advantage, just for a minute. There are some advantages to it. It offers the same the same benefits as original Medicare, okay? It includes medical prescription drugs in the plan also. Some do not, okay? And lastly, it has a maximum out of pocket that you would spend. Now, with original Medicare, there is no maximum, okay? So that means that, say you go to the hospital, you get billed whatever the percentages that you get billed. Let's just throw out a number, $100,000, and Medicare pays 80%. You're responsible for 20% if you don't have a Medicare supplement, responsible for the 20%. What they're saying is that there is no maximum. You go back in the hospital again, that 20% of the $100,000 is $20,000. You go back again, and there's another 100. Now you've paid $40,000. You go back in, and there's another. You see what I'm saying? So the amount that you could pay under original Medicare, not having a supplement added onto it, it could be considerable. So just understand that it is important to either, like you mentioned, to consider a Medicare supplement or consider a Medicare Advantage because of the maximums that you'll pay.
Can I
Okay.
interrupt you one second?
Please, someone just
That's
answer.
me.
Please. Yeah.
We do have people online. I just want to let our online people know, if you have questions, please type in your questions, and we can answer those questions as well. Thank you.
Thank you, Melanie. I appreciate that. Okay, 3 types of Medicare Advantage plans. Let's get them all out of here. HMO is one. A PPO is another, and a private fee-for-service. Very few of those are being offered now, the private fee-for-service. But the PPO and HMO plans are plans where you're seeing a network of doctors, a network of providers. Your doctor has to be in the network. If he is not in the network and you go see him, then you may be the one responsible for paying that doctor the full amount. PPOs allow you to go in and out of network. So you could have an in-network doctor, but you can also go out of network and see an out-of-network doctor. You're just going to pay a little bit more to see that out-of-network doctor. But you get the beauty of being able to do both with a PPO, okay? The private fee-for-service is a plan where kind of the same thing, but what happens, that provider may at that time not be in any network, but may say, okay, but we will accept your plan benefits based on whatever terms and conditions that we've accepted. We'll accept you in this particular plan, okay? So it just kind of depends. I'll tell you that with an HMO, most of them used to require referrals. They have now, most don't require them now, okay? But you still could have to have a referral to see a specialist. Okay, Medicare Part D, and this is where we've really, this is really where the biggest changes have happened for 2025. Okay, once again, I told you that with a Medicare Advantage plan, it could be one that has a Part D, prescription drug plan within the plan, and you could have, or you could have a separate prescription drug plan only with a Medicare supplement, okay? All right. So every plan with the prescription coverage has a formulary. So all of your medications are on a particular formulary depending on which plan you pick, okay? Secondly, if you choose an MA plan without a prescription drug plan, you won't be able to get a separate standalone one. And that's because most of those plans that are MA only are PPOs. They're not plans where you can actually have a prescription drug as a part of it. And most of the people that do the MA plans without prescription drugs are veterans. So they're getting their prescriptions through the VA, okay? And lastly, you're not required to enroll in a Part D. I'm sorry, you're not required to enroll in a Part D, but there's generally a penalty. I'll read that, but let me tell you what it's saying, okay? So this is the thing. When you turn 65, remember I told you you're eligible for Medicare. So they automatically do Medicare A. You get Medicare B. But you can decide whether you want to get Medicare Part D or not. Okay, and a lot of people says, no, they said we got to get Part D or else. Well, yeah, the else is you'll have to pay a 1% penalty for every month that you did not enroll in a Part D plan when you were eligible. But it doesn't mean that you had to do that. You just have to be willing at the time that you actually decide to enroll in one later on in life. You know, I'll give you an example. I had a client that when I first met her, she was 72. Well, she turned 65 about, 72 was that, 7 years before. Well, she wasn't on any medications. She says, Pat, I don't take any medications. I'm perfectly healthy. So I said, I don't want a Part D plan. Why should I pay a premium if I'm not taking any medications? Well, once again, she wasn't required to. She could make that decision that I'm not going to do it. But then at 72, she developed diabetes. And so at that time, she had to now start taking diabetic medications, right? And some of the more expensive tier 3 medications that she was taking. Well, when that happened, the insurance company sent her a bill saying, hey, have you had prescription drug coverage in the last 7 years? And she says, well, no, I didn't need it because I wasn't taking any medications. Well, she got a bill for the 7 years. It was somewhere around $32 now that they were adding on to her regular prescription drug plan because she didn't get it at the time that she was eligible to get a prescription drug plan. So, no, you don't have to, but you have to be willing to pay the penalty if you didn't, right? So that's what that is saying. You're not required, but I'm saying get it, right? When I talk to my clients, I tell them, look, I get it, you're not on a particular, any medications. So we're going to look for the least expensive prescription drug plan that's here in Virginia. And that's what we're going to do, okay? So that you're covered. All right, where did I put, please.
That amount that client paid, was that a one-shot deal for medication, or that was her additional premium?
That was her additional premium, and that premium would be for the rest of her life.
That's, so the question I asked, I got
Okay.
a microphone, was that additional $32 or for that client was not for a single prescription, but it's for each month of that, each month premium going forward.
That's correct.
Okay.
So let's say that the premium for that plan was normally $8 a month. She had an additional $32 a month that she had to pay, so now hers is $40 for the rest of her life. That's how that works. Okay. The drug tiers. Now, one of the things that I want to share with you is that most drug plans have about 5 tiers. Some of them have 6. The first couple of tiers are generic drugs, and you probably already understand that. The next, did someone say? You don't understand that? Okay. So, the way that drug plans work, they have tiers. And the higher the tier, the more expensive the drug is. So, what the different companies do is on their formulary where they have all of their drugs that are listed, they give them a number, tier 1 for generic drugs, preferred generics as a matter of fact. Tier 2, regular generic drugs. You're gonna pay a little bit more for tier 2 drugs. Tier 3 are preferred brand name drugs, a little bit more for that. Tier 4, non-preferred brand name, a little bit more for that. And specialty tier actually covers some drugs like, let's see, multiple sclerosis. I have a client that has a specialty drug that covers her multiple sclerosis. That one is on a tier 5. So let's talk about that. I am so, see, you looked at my paper ahead of time. See how she does? I love it, because we're getting to that point right now. I gave you a sheet. She said, so those on that list, what are those? So look at that sheet now that she made. And the people that are online don't have that sheet. However, I'll make sure that we make it available to you to kind of take a look at it as we go. Okay, so back in August of 2022, President Biden signed into law the Inflation Reduction Act. I don't know if you guys have heard about that, but that's what he did in August of 22, because he wanted to make sure that individuals that are on Medicare get an opportunity to pay lower costs for their medications. He's very concerned about the high cost of medications for Medicare enrollees. So, August of 22, he signed it. And what he said was this, that we're gonna make sure, I know y'all remember the first thing that he did for 2024. He says, your insulin is not gonna be any more than $35 a month, right? Did that happen for you all? Are you paying more, those of you that may have insulin, are you paying more than $35 a month? No, because that was, when they wrote it into law, that's one of the things that the manufacturers had to come to the conclusion of, that they could not charge more than $35 a month for insulin. Well, in that process, he was also looking at other medications that people are paying a tremendous amount of money for. A lot of those weight loss medications, which are not really covered by Medicare, but if you're on one, it's because your doctor says you also have diabetes or cardiovascular disease, and that's why you're on it, okay, supposedly. All right, but there are medications that are on a particular level that he wants people to stop having to pay that amount of money for. So what happened with that Inflation Reduction Act in 2022, he went to manufacturing companies of some of the medications, and he says, we're gonna start negotiating the costs because you're charging too much, beneficiaries are paying too much, and we need to look out for our seniors. And so with that, they had to negotiate. What I gave you all is the first 10 drugs that have been negotiated prices down with the manufacturer. Now, these particular medications really were, depending on what company you actually had your prescription drug plan with, they were either tier 3 or tier 4, so the more expensive medications. So that was your question, but yeah. So with this, I can't tell you how much these medications are, but let's talk about it for a minute. I'm just gonna read some of them out for the people that are online. Eliquis is one of the ones that manufacturer had to negotiate the price down with the government. Jardiance is another. Xarelto, that blood thinner, is another. Januvia is another. Farxiga, Entresto, which is for heart failure. Enbrel, which is for rheumatoid arthritis and psoriasis. Now, somebody's gonna have to tell me how to pronounce this. No, I'm just gonna call it Imbruvica, okay, for blood cancers. And Stelara for psoriasis and that kind of thing. So these are and then, of course, these insulin pens. So these are the first set of drugs that the government is negotiating with these manufacturers. Now, in 2026 is when you're gonna see those drugs come down. So what he did in 2022 was try to do like this tiered approach. The first thing, we're gonna cover insulin because too many people are paying too much money for insulin, so we're gonna bring that down to 35 and call it a day. 2026 are these next 10 drugs that are going to be the negotiation of these prices are going to go down in 2026. So now you know that right now in 2024, that in 2026, these medications are going to be reduced. We don't know what that is. We'll see probably sometime late in 2025 what it's actually going to be. But that is what's happening. Now, for 2025, let's talk about that. So that was a great question. But let me mention one other thing, too. So as an example, Jardiance, that's a diabetic medication. Now, this is the thing that you all have got to understand about this. The total gross Part D, gross covered prescription cost for this drug from June of 2022 to May of 2023 was $16 billion. This is how much has been paid for that drug, Eliquis. $16,482,621,000. Combination of what you had to pay if you were on that medication, plus what the insurance companies paid. That was between June of 2022 through May of 2023. Isn't that crazy? Now look at the number of people that were on that medication for that period. That was 3,706,000 people were on Eliquis that paid that amount of money for those drugs. So you see why Eliquis was one of the first ones picked. Because they're trying to bring down those costs. Look at Jardiance. $7,057,707,000 was paid by members, Medicare members, and insurance companies. 1,573,000 were the actual number of people that were on the medication. So, the reason that they picked these particular medications, I mean, there are a couple of reasons that they did. One is they may not have a generic counterpart. You know, a lot of these brand name drugs have a generic. I'll give you an example. Let's say, what was the name of that medication that those, it's a statin drug now, but God, I can't think of the brand name medication now because it's been so long. Lipitor, right. Well, Lipitor has the generic atorvastatin, pravastatin, one of those, okay? So the statin drugs is a generic form of that particular medication. And as a result of that, Lipitor and all those have to come down because of the competition. Well, Xarelto doesn't have that competition. So right now, the manufacturer, at the time, they're able to make a judgment of how much they want to charge for that medication. Yes, sir. Oh, what happened? My partner left the mic. Hold on, I got it.
The reason why a lot of these drugs are so expensive is because the manufacturer, most of the time, has 10 years. After that, they could develop what they call it, the generic drugs.
That's correct.
So during this time is when they make their money.
Exactly.
After that, the government could go and get generic.
Exactly.
So maybe Xarelto hasn't come to that stage.
Has not, exactly, which is why it's one of the ones that's on this list.
But after this period, wouldn't the generics might even be cheaper?
Yeah. Yes, absolutely. Yes, ma'am. Oh, sorry.
When your doctor is placing you on a prescription, and I'm not sure where it falls on that tier.
Right.
If I said to him, is this a generic or preferred generic?
Or brand name,
or
right.
brand name. Well, he said to me that it depends on what prescription plan I'm on. It's like he doesn't know because it depends on my Part C is the
Part D.
Part D. So if he don't know and I don't know, how can I tell?
Okay.
What if there is a generic or preferred generic that I can take in that drug instead of taking something and I'm going to have to pay buku money for it.
Good question. One of the things that happens with me and our clients, I'll tell you this, is if I have a client that is concerned about the medication that she's been prescribed by her doctor, and she's on whatever plan it is. We can't talk about those plans. But anyway, whatever plan it is, what I'll do is check the plan to see what the cost of that prescription is and to see if there is a generic counterpart. Because most times when we put in that particular drug, the insurance company in that calculator can tell us whether it's a preferred brand and it's just the brand and it does not have a generic equivalent. And then you could mention that to your doctor. But a lot of times, once again, unless you have somebody that can check that for you, I know. He should know, but I'm just saying. He should know, but okay. Pharmacy, of course. Absolutely. So you could indeed check with the pharmacy. Yeah. Yeah. But the truth is, whatever it is, that's really kind of between you and your doctor. And, sorry, he had a question.
I think you're getting at, can you ask for it? And
the question is?
Can you ask for it? Yeah.
Yes. Absolutely. Now, it also depends on your doctor. Okay, so now you all are trying to get me, like I'm on tape now. Y'all know they have me live streaming and stuff and all of that, and you're trying to get me trapped here, but no, I know you're not. But there is something after this is over, let's you and I talk again, just for a minute. And it's not specifically about your plan, but just about some things that you might want to consider, okay? How about, let's do that. That way, yeah, she caught me real quick. She knew I was getting ready to go there. Yes, you can. Good, thank you. You are the best. I appreciate that. Okay, so yeah, that's where we are. Okay, so now this is the change for 2025. So now we're getting ready to give you the actual update of what happened for 2025. Remember, when you asked me about those prescription drugs, that's going to happen in 2026. In 2025, this is the new change. In 2024, there were 4 levels or 4 stages for prescription drugs. The first stage was the deductible stage. I don't know if any of you had this where, you went to the pharmacy, your medication was supposed to cost $47, but they told you no, it's going to cost you $594 because that was your deductible. After that, then you'll pay whatever the amount is, okay? So the first stage is the deductible stage. That is going to continue in 2025. The next stage is the initial coverage phase. And that's the phase where what you pay plus what your insurance company pays together, you all are paying that together to reach the 100%, whatever the amount is that insurance company requires you to pay. In 2024, stage 3 was also called the coverage gap. So people that were taking medications that tended to take them to the level of having to fall into the donut hole, if you've ever heard of that. That was that was stage 3. In 2025, they've knocked that stage out. That is no longer, the coverage gap is no longer going to be in 2025. Once what you've paid in prescription drug costs reaches $2,000, this year that amount was $5,000. Once it reaches $2,000, that's it. You don't have any more copays. Your prescriptions are zero the rest of the year. That's how that works. $2,000. Now, I have some people that told me, 2,000, you act like you just told me 100. Right? 2,000 is 2,000. That's still a lot of money, right? But 2,000 is not 5,000, which is what a lot of people were paying this year, right? And so just keep in mind, the maximum is 2,000. That's it. Once you're there, it's zero for the rest of the year. Now, the government has, just like the government does, it has all of these different iterations of how to do the calculation and all that kind of stuff. All of that is coming. But I'll tell you this, that they have also come up with this plan. It's called the Medicare Payment Plan. Medicare Prescription Payment Plan. M3P is what they're calling it. And so what's happening is where you don't have to pay the full amount for your medications depending on what tier it is. You may have a higher amount that you're paying starting off in the year. You would be able to make arrangements with your insurance company. It happens once you've enrolled. So for people that are already on a prescription drug plan right now, you could actually at October 15th call your insurance company and say, hey, I want to be on a plan, a monthly payment plan. I don't care if my medications are $700 a month. I want to be on a monthly payment plan where I could pay less than that every month until I reach $2,000, okay? Your insurance company will provide that for you to be able to do that, okay? So just keep in mind. So I think a lot of times, when we're seeing these new regulations come out and we're concerned and just not sure how we're going to be able to do it, that's one of the things that's a part of that Inflation Reduction Act that President Biden came up with so that people could have reduced costs for their prescription drugs. Your prescriptions are still going to cost the same amount that they're going to cost, but you're not going to pay more than $2,000. So the third stage is a catastrophic phase, and that means that your cost would be zero at that point for all your medications. Now, when you talk with your insurance company about it, about how you're going to do it, if you're a person that's on a generic medication, right, and you're paying zero for your medications now, don't get on a Medicare payment plan and pay $166 or whatever it is. You understand what I'm saying? So you really have to kind of look at what your costs are going to be to determine whether that is the way for you to go. Okay, and so one of the things that if you do have an agent, one of the things you might want to talk to them about is taking a look at all of your medications, running them through the calculator to see what your costs are going to be. Once again, they can do all of that after October 1st. Okay, so that's the biggest change that's going to happen for 2025 regarding Medicare, right there. Let's see. Oh my goodness, she left out. But I hope that someone will have her call me one day, but about the Medicare supplemental plan. So when you're looking at Medicare Advantage plans and Medicare supplemental plans, I tell people look at it from this perspective, that Medicare is going to get you on the front end or they're going to get you on the back end. That's how I look at it, okay? So either you're going to pay a premium up front so that you don't have any co-pays on the back end or fewer co-pays on the back end, or you're going to pay little or nothing up front and then pay your co-pays as you go to your doctor, to the hospital, to the emergency room, that kind of thing. So with Medicare supplements, what happens is you have original Medicare, A and B. The government pays the 80%. Now you have 20% that's left. So with the Medicare supplement, that Medicare supplement company says, okay, we'll pay the 20%. Yay, we like it. We're going to do that for you. But in exchange for that, you have a premium that you're going to pay every month. And it's generally, I can't tell you what that amount is unless I run your numbers. But just know that you're going to have a premium that you're going to pay every month for that benefit. Okay? And then in addition to that, you're going to have a prescription drug plan because Medicare supplements don't have the prescription drug piece. On the other hand, a Medicare Advantage plan, once again, that's run by private insurance companies, not by the government. Because think about it, once again, A and B by the government, right? They're covering that. They're administering that part of it. Your Medicare supplement plan that you pick is administered by whatever company you chose, and your prescription drug plan, once again, is administered by whatever company you chose. So it's a combination of the government and the private insurance company. When you have a Medicare Advantage plan, on the other hand, here's what the government said. I'll just throw this out there. Let's say it like this. You pick a particular company. I'm going to go with this Medicare Advantage plan with company Green. Very good. I'm going with company Green. Thank you very much, Ms. Jones. And so I'm going with that company. The government says, you know what? Okay, you pick Green, you can go with Green. This is what we're going to do. You know that $174 you're paying every month for your Part B premium? That one? So normally, it's coming out of your Social Security check, right? And then we're using that to help pay your Part B services and everything, right? They say, well, because you picked green, and that is the color you're going with, we're going to take that $174 that you're paying to us now, and we're going to send it over to Camp Green, where you decided to go, all right? And now they are responsible for all of your Medicare administration. So it's sent over to that company, and then that company decides whether they're going to charge an additional premium. Most times they don't, but some do. Or it may be a zero premium. They may have decided, look, we'll just go with the 174. We'll take that for $500, Alex. That's enough. And then we will run your Medicare program. And so with Medicare Advantage plans, that's why they're able to offer some of the additional things that they offer. The dental and the vision and the hearing and some plans, grocery. So it just depends. Okay? So that's really the difference. The Medicare Advantage plan is administered by a private insurance company. Original Medicare, Medicare Supplements is a private insurance company, but they're only paying the difference between what Medicare is paying and the 20% that you would have to pay. And that's really the difference between the two. So what happens is your Advantage plan may be a zero premium, but it has co-pays on the back end. I call those back end plans. That's correct.
Repeat that again. You said the copay, the premium is zero?
So with the Medicare Advantage plan, it may be zero. It depends on the plan, right? So it could be a zero premium. And if it is indeed a zero premium, you're going to pay co-pays as you go to the doctor, as you go to the emergency room, as you go to the hospital, as you have to have physical therapy. And they determine what those co-pays are. On the other side, with Medicare supplements, it's an 80% coinsurance that the government is paying on your behalf because they like you. And the 20% is the amount that you would normally have to pay. But if you're in a Medicare supplement, that private insurer took on that 20%. Depending on which, now even within that, there are different plans. There's a Plan A, Plan B, Plan C, Plan G, Plan F, high deductible F, K, L, okay. So you have to determine which one meets your particular needs, and that's why, talking with an agent can help you to determine that. And then you have to pick a prescription drug plan. Okay, we're almost at the end. Look at that, I know y'all be glad when it's over. Okay, special needs. Now, just to kind of throw a little bit of a ringer in there, Medicare Advantage plans have there are different types of Medicare Advantage plans. There are special needs plans for people that have Medicare and they have Medicaid. Those are called dual eligible plans. And so those plans work together, federal and state for the Medicaid work together and give you whatever benefits that it is for a dual eligible plan. So there are some plans that are just for people that have Medicare and Medicaid. There are some individuals out there that are in just a regular Medicare Advantage plan that don't get the benefit of the coordination of the Medicaid part. I tell those individuals, look into it, because you're going to get additional benefits that you would not have gotten had you just chosen that Medicare Advantage plan over doing a dual plan. All right? Number 2, a chronic condition special needs plan. And that's a plan for individuals that may have like diabetes or some other chronic condition. And that plan is designed to assist you with additional counseling regarding nutrition and food and everything with that particular plan. So you get some additional benefits with being in a chronic condition plan. And lastly is the institutional special needs plan. And that's one where you get an opportunity to enroll in a plan if you end up going into like a skilled nursing facility. You may be in a particular Medicare Advantage plan. You go into a skilled nursing facility. You may have additional benefits that you'll be able to get if you enroll in an institutional special needs plan. So they have all of these opportunities for you just based on special conditions. And I think we kind of talked about special conditions earlier. All right, additional assistance, there are Medicare savings programs, extra help. Now, this is something I really want to, and Medicaid. So, I mean, I know all of you have heard about Medicaid and how it works. And like I told you, you're able to get Medicare and Medicaid. They're coordinated through a dual eligible plan. Extra help is one that I like to mention when I'm in one of these seminars. The reason I do that is because the federal government has a program where you can apply for what's called extra help. It's a very simple application, doesn't take a lot to complete. I tell people complete it anyway. You may qualify for it. And if you do qualify for the extra help, what happens is that there is a plan that they have out there, these different companies, just for people that qualify for getting extra help for paying for your prescription drugs. So when you mentioned, like, for example, Jardiance may have been one of those medications that's on a higher tier, for example, then if you're getting extra help from the government because of the fact, based on your income, that's what they're looking at, but it's not the income that they would be considering if you were on Medicaid. So you can make a higher income for and still get extra help, is what I'm saying. So I tell people, apply anyway, just to see. It takes them about 3 weeks to get the information back to you. You'll get it in the mail, and they'll say, hey, congratulations, you qualify for extra help. And you didn't even realize that you actually qualified for it, because it's not saying that you can only have $200 a month in income. You can have a little bit higher income and still qualify for extra help. So I tell my clients, we're applying anyway, just to see, yes. Are you still in a federal government plan, though? Oh, okay, so no. That would be, yeah, so that would be for individuals that are in Medicare Advantage plans and that kind of thing. Or regular prescription drug plans, for example, okay? So you have an opportunity to at least try. And honestly, if you want me to help you do that, we can just do it, because it is, I think it's crucial. I have had so many clients that when I said, let's just do it, and they said, no, Pat, I don't want to know all my stuff, all my business and everything, I don't want to do all that. Well, it's not the same as applying for Medicaid, okay? They're asking for fewer information for extra help, but it may be to your benefit to do it, okay? Okay, I think. On Medicare.gov, yes, you can. What you'll do is put in Medicare.gov, click on it, and then in the search bar, put extra help. And they will bring it up, okay? And it is not a difficult application to complete. Medicare.gov, in the search bar, extra help, you'll see the application. Okay, factors to consider. Now, this is just to have you understand that you always got to look at the cost. What is it going to cost you to have that plan? The coverage that it's going to cover. If your doctor's not in the network, then why would you get in that plan, right? Unless you decide you're going to change doctors. And generally, people aren't trying to change doctors in the middle of the stream. Okay, network, once again, the doctors. Convenience, right? So do you have to fill out your own claim forms, or is a doctor going to send it to the insurance company on your behalf? So those are things you have to look at. Your health history. Maybe you should consider a chronic condition plan, depending on what your health conditions are. And lastly, your future. Understanding that all of our all of our bodies change over the years. And a plan that may have been a great plan when you first got in it in 65 may not be the one for you now. And it may be that at 65, because you were healthier at 65, maybe, you got in a plan that, well, didn't have all of these additional benefits. You didn't really pretty much care about whether you had dental in it. Well, now, you may look at it again and say, well, I want to consider dental. I want to consider, now that I have a chronic condition, looking at a different type of plan. So just looking at everything and making that determination as to what you're going to do and where you're going to go with it. And lastly, this is an organization that assists people with trying to get into Medicare Advantage plans, or even understanding how Medicare works and that kind of stuff. Just want to make sure that you know that it does exist. I will say, if you have questions about Medicare and questions about your plans and that kind of thing, I would love it if you would give me a call. I'd be more than happy to assist you if you need it. And that is it. Oh, one thing I did forget. This book right here. How many of you got it this year? Thank goodness. Okay, so this book is very, very important. It gives you good information. All right, I always tell people to pay attention to pages 9 and 10, because it talks about Medicare Advantage plans compared to Medicare supplements, so you can understand that whole thing that I talked about, original Medicare, Medicare supplements, prescription drugs, 9 and 10. 83 discusses the new updates for 2025 regarding prescription drug plans. So if you don't do anything else, read those 3 pages, because it explains to a certain extent a little bit more about what's happening with these plans. Okay? Page 83, 9 and 10. Okay, and I think that that's probably the end. Let's see. Oh, if you have one of these sheets here, it's somewhere around here. It's on this sheet, yes.
And it's also on our website.
That's correct.
It's
Melanie
also
was so
on-
gracious to do that. I also have another sheet here it's called Permission to Contact. And so you all have this sheet also. So if you want me to call you and talk to you about your plans, after October 1st, I'll be more than happy to do that. But if you want to call me, and let me share that with you. No agent should be able to call your house without your permission. If they're calling you about these plans, they are calling against the law. They're not supposed to. And you can say, may I have your name? Yeah, they will. But they may not know that's what you're doing. So you get their name, and you can report them to Medicare. And Medicare will go after them. They are not supposed to do that. Now, that stuff, look, let me tell you something. Wouldn't that be nice if we could just if y'all could stop us from sending a postcard to your house, right? Because we do. We send postcards, letters, and all that stuff, because that is the thing that we can do, that they allow us. But knocking on your door, one day and say, hey, I was in the neighborhood. That's what life insurance agents used to do all the time. They even trained us, years ago. I've been in this business for 31 years, so imagine back in '94, we were knocking on doors for life insurance, right? So, they're not supposed to knock on your door. If they knock on your door, get their card and their name and report them to Medicare.
Or there could be scammers, so please be careful
That's correct.
giving out your information.
That is correct. So just please, 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 really get with someone that you can trust, that you feel comfortable with, that's going to share, as much as you need to know about what's going on with you. I think one of the things that's very important is if an agent is not doing a needs analysis, looking at what your goals, what you're looking for, if you say to an agent, what's most important to me? I'm tired of paying these high prices for my prescriptions. Well, they may or may not be able to help you with that, but at least they heard you say that, and they're looking at the plans that may have lower copays than another. Or if you're saying, I'm interested in dental, they may find a plan that has a dental benefit in it that may be higher than another dental benefit. But if they're not listening to what is important to you, that is the problem, okay? So when you're talking to an agent, make sure that they're asking the questions that are important to you. And that is all she wrote. Y'all have a great day, and thank you all so much for allowing me to speak to you today.
All right. Thank you all for coming out. Thank you, Pat. And I want to reemphasize, too, that she will be back October the 16th.
Oh, that's right.
Where she can really answer all your questions.
We can talk about plans.
Yes.
On October 16th.
And things that you may
Questions that you may
have. Yes.
specifically about your plan.
Yes. So put that on your calendar.
Y'all saw me, right? Y'all saw me really do this to try to keep them talking more than I should.
October 16th. She will, at 11 o'clock, she will be here. So let everybody know that has questions about their Medicare or any other insurances. She just doesn't do Medicare. She does disability insurance, life insurance, and the regular health care insurance, the Obamacare insurance. So any insurance. Yes. And I've been blessed to know Pat over 21 years. So, yes. Anytime I've called her, she's answering my calls. So I am grateful to share her wealth of information with you all, and I pray that you all will share what you heard here today and tell others so that they can come back on October 16th at 11 o'clock. She will be back here again. That way she can really dive into what questions you may have about your Medicare insurance that you have now. Thank you all for coming out. Thanks for everybody online that's watching. And you too, October the 16th, we will be back. See you then.